Welcome to the Root of Power podcast, where I teach you how to step into your power, find alignment, and create a life that you love using holistic methods, interviews with industry leaders, and inspiring stories from people who know that true freedom is found within. I'm your host and health and wellness bestie, Amanda Chills, and I'm so proud of you for choosing to step into the root of your power. Y'all, I have got a treat for you today. I interview a family member. Eventually, we're going to have my dad on this show, but that's a whole separate thing. I interview my cousin Aliana, who is a nurse and has been a nurse this whole pandemic in Florida. And so we talk pandemic anxiety and working in healthcare during this time and how to practice self-care and Florida man and in general, kind of what it's like. And I am so excited. She has such a good energy. She's so grounded. And you're going to finish this episode and be like, oh my God, how do I become her friend? Like, she's so awesome. So I'm very excited for you guys. And tell me how you like it, of course. Actually, take a screenshot and share it on Instagram. I love seeing people who are listening because sometimes I don't know. So it's always reaffirming selfishly for me to be like, okay, people actually listen to the show. And if you need support, if you need anything, I have actually got a wonderful thing for you where you can have 3 steps to building healthy, sustainable habits. Now, these can be physical changes, they can be mental changes, they can be whatever. If you head to my website, livemyhappyhealth.com, you are going to see it, and it will help you change your life. So you are welcome. Let's get to this episode, and I can't wait for you guys to hear it.
I'm ready. This one records really fast. So welcome, podcast fam. I have got my favorite cousin on today. Oh, I'm going to call it favorite cousin, hands down. Sorry, guys. Love you too, but Ollie is the best. And she is a nurse in Florida who is just totally killing it. You're in your master's program right now for nursing. She's doing that. So she's a full-time nurse. You guys are just going to be like, oh my God, I want to be Aliana's friend. And you should, because she's awesome.
I agree.
So she agrees. So we are going to talk about healthcare workers, self-care in the time of COVID, what it looks like, because you are kind of in a unique position where Florida is pretty open. They don't have the same restrictions that other states have. So it'll be interesting to see what's going on in an open state versus a state with regulations like North Carolina. So welcome, Ollie.
Thank you.
Tell us about you, please.
I'm so excited. First of all, so happy you asked me. I miss you. So I'm a nurse. I work at Lakeland Regional Health. It literally hasn't been crazy until recently, when everybody was like, oh, there's a new strain and, let's go around Florida like nothing's happening. People always joke, all these celebrities are acting like there's no pandemic, but honestly, I kind of feel like Florida's doing that. We're a celebrity in ourselves.
Florida man is around.
Yes.
To be fair, Florida man is a celebrity.
Yeah, alive and well.
So that's really interesting because I have county clients who are EMT and 911 dispatch, and they are picking up 4, 5, 6 COVID deaths a day, just in our little county. And we're not the biggest county in the state. We're one of the probably more sparse counties in the state. So they're having, 4, 5, 6 COVID deaths literally per day here. Our hospitals are really overwhelmed. You look at states in California who are doing mobile morgues, and they're not allowing cremations because everything is so overflowed. So that's really interesting because in a state that has restrictions like North Carolina does and Florida is not, in Lakeland, for people that don't know, is a huge area.
Yeah. Our hospital serves all of Polk County, which is huge.
I don't even know how many people are in Polk County, but it's got to be in the hundreds of thousands.
For sure. Yeah. I mean, Lakeland alone, I think, has 100,000, if not a little bit more by now. Probably. And I mean, so we're doing Winter Haven, Auburndale, Mulberry, Bartow, Polk City, the surrounding area. If you can't get into Tampa General, you'll come to Lakeland.
Yeah.
Yeah, our ER is the busiest in all the nation, just because we do service so many areas.
And you're not seeing that many like overburdened hospital systems.
Yeah, I mean, not yet. I know our hospital's full. They just announced it. I want to say like 2 weeks ago, we're finally getting pretty full. Like they're actually asking anyone, no matter what your position is, to go fill into other positions like housekeeping or, food, transporting, things you can do safely. Like they wouldn't ask me to go to like the ICU. Yeah. Because that's dangerous. But they're asking you to do things that are within your scope because we're just so busy, and our staff is getting sick too. So you kind of have to cover that. And, nurses are always notoriously short. So this isn't helping.
Yeah.
So
that's really insane. What about, so I've seen a lot of rhetoric, and I want to touch on it before we get into reality. A lot of rhetoric about like hospitals faking COVID. So you'll hear a lot of conspiracy theorists. Have you not heard of that?
I haven't, but
oh my God. Intrigued. Okay. It is the stupidest thing I've ever heard. So there's a huge conspiracy theory that says hospitals are faking death certificates and just saying everyone is dying from COVID-19 to inflate numbers because you get paid exponentially more when it's a COVID death. So
that is true.
You get paid more when it's a COVID death.
Yes, the hospital does. Not like us, not the staff, but the hospital itself.
Why?
I couldn't tell you. I think it's a Medicare thing.
Oh, that would make sense.
Yeah.
Have you seen fake records, fake medical records?
I don't, honestly, if I had seen one, I wouldn't know if it was fake. A lot of practitioners dictate through, it's called Dragon, and you just talk into it and it dictates for you. And then someone on the other end goes and translates it if you can't. Like if the Dragon system can't understand it.
Yeah.
So there are a lot of mistakes already in people's records sometimes just because of like that, human error.
But how hard would it be to fake a whole COVID patient if they did?
Yeah, that's what I'm saying. That I don't know how you would do it because there's so many people involved in one record. How would you get all of those people to be on board for, one thing like that?
Yeah. So hospitals do get paid more for COVID, but in order to fake all of those records, it would be like multiple people would have to be in on it because you also have not just one nurse the whole time. You have the different shifts and there's lots of people involved.
Yeah. I mean, there's so many people you go through in the hospital that, gosh, I just couldn't, that's an elaborate plan. You would literally have to have so many moving pieces.
Yeah.
I couldn't, because all it takes honestly is like one person to catch an error in something and then you tell somebody else and then that would also snowball
right. You would be like, hey, this client doesn't actually have COVID. And then they're like, well, why does it say that all over the chart?
Right. And then you do a lot more like research into it. I feel like this just happened recently, not with COVID itself, but we had a patient who there was an error on the chart and it was a serious medical condition, and so we had to do more research into it, come to find out that it was an error. So that's what I'm saying. Like if somebody was manipulating a whole record for COVID, somebody
and like
multiple along the way.
Yeah. So it's fascinating that you haven't heard of that because it's been existing.
I
for as long as like people I know are like, well, they're just saying everyone has COVID. And it's like, that's literally illegal. Like it's literally illegal to do. You can't fake medical records. Like it's fraud.
Yeah.
You can't even have the wrong time on something, like that's fraud. So you can't just make up a whole thing.
Yeah. I don't know. People are starting to drive me crazy with like the whole, oh, it's fake. It's just in the media. And I'm like,
do you have a lot of people who come in demanding to be treated who think it's fake?
I wouldn't necessarily see people wanting to be treated like for COVID and they're like, well, it's not real. I don't have it. Everybody thinks that they're a practitioner when they're in the hospital. They're like, I know what I need,
Yeah.
So I would say that comes around a lot. Like I demand this right now for this, even though you might not have it.
Right. You might not have it and that might not be why you.
Yeah. That might not even be why you need to be here. But, everybody thinks they know what's right sometimes and they don't.
Fair.
Yeah.
So what's it like being because a lot of people are getting tested at hospitals, that can often be like the first stop that they make versus their general practitioner and urgent care. What is it like working in a hospital during a pandemic?
Weird. God, it feels like a movie sometimes. It honestly does. Like, so when everything first started, and we had that huge shutdown, and I work in GI, so I'm part elective and part like emergency
Like surgeries. Is that what you mean?
Right, yeah. So during that shutdown, we were all working part-time, and it was like, this is really nice. I get to hang out at home. I love it. But then you have to go back, post shutdown.
Mm-hmm.
And it was just so weird because you had to wear a mask. You have to get your temperature checked. Like, if somebody coughs, you're like, what was that?
Get out of here.
Right. It's so eerie. And I know, like, for me, like, I already have anxiety. Like, that's way before pandemic, but being in it and then working in healthcare was just so, like, stressful internally,
mm-hmm.
because especially in the beginning, nobody really knew anything.
Right.
But as a nurse, like, I can't say I'm not going to go to work, like.
Right. Yeah, you don't really have an option.
Right. So, and you do what you got to do, but it's so, I don't really feel as much anxiety anymore as I used to, but I definitely was, like, very anxious anytime I had to go to work, or, like, if people wanted to hang out, like, after work, I'd be like, well, I was just in the hospital, where we didn't really have as many measures as we do now.
Mm-hmm.
Not to say that anybody's got the answer for anything, but
over time, as you, like, understand, and it, like, reaches more people, your measures are going to change. Like, that's just.
Yeah. I mean, so I do COVID testing. Like, I am the person that tests a lot of people for the first time. And I know
mm-hmm.
their anxieties with that, and it is a fairly quick test. It's not, I mean, it's terrible, but it's not awful, and, so, I try to talk to people about that whenever we're doing the testing. And then by the time they get to me in my department, they have to have a confirmed negative. So we're pretty much, we all still, social distance, wear our masks,
mm-hmm.
wash our hands, do all the good stuff. So they have a confirmed negative when they get to us. We're good. They leave, they go about their business. Now, every once in a while, we do get, like, the emergent case that is positive.
Mm-hmm.
And in that situation, we actually have to go to a completely different part of the hospital. We have to gown up, and I kid you not, it looks like a Ghostbuster suit mixed with, like, the Alien versus Predator helmet. Like, that's what you can picture that you have to wear.
Yeah.
And for us, it sucks. You can't breathe. You can't hear anybody because you've got this air blowing, like, literally right past your ears.
Because it recycles air, right? That's
right. Yeah, it goes through a filter, it recycles it. But you also have to wear your respirator so nobody can hear you. It's like,
Yeah,
it is. And then you feel so bad for this patient because, like, we literally look like something out of this world.
Right.
For this poor positive patient who's like we had a patient one day that was like, am I dying? Why are you dressed like that? Like, and, like,
because you're suited up in, like, a freaking hazmat suit, and they're like, oh my God.
Right. You're like, this is the end of times. This is it for me.
Right.
It's so scary. So I think overall, in general, working in a pandemic is nothing but, like, anxiety inducing. Like,
how have you dealt with it? Because, like, humans can get used to anything, right? Like, humans are extremely adaptable, but how do you do it? How do you show up to work and not just have a meltdown every day? Like, how do you do it?
I wait till I get home. Yeah, no, for me personally, I'm very much the person, like, I do things that make me uncomfortable on purpose just because I want to grow. And I know that, like, through continuing to do that, I will grow and eventually be comfortable with it, and so now I go to work and I'm good and I have no issues.
And it's your new normal.
Yeah, a new normal. It is what it is. I don't know, man. It's just, you have to do it. And I'm pretty sure almost every nurse will tell you the same thing. You have to do it.
Yeah.
You can't.
There's a very specific subset of people that can do that, though. So, like, maybe more specifically, like what have you done, like specific actions you've done that help? Like for me, I'm aware of the conspiracy stuff, but I can't.
Oh my God.
If I'm like, I have to purposely avoid doom scrolling on like Instagram, where you just go down a thread and like you're pissed off at every post. Like sometimes I'll do that and I'm like, Amanda, get the f off Instagram.
It's not going to solve anything, you know, you're just driving
I'm just pissed. Like, I'm just angry. So I have to purposely avoid conspiracy theories, the doom scrolling.
Absolutely, yeah.
So like, what do you do? Like, do you take more downtime? Do you, what have you done that's helped?
Yeah, me recently, because it is getting so out of hand, I have taken a step back from social media. I just kind of like, I limit myself to, you know, in the morning and then maybe at night a little bit, but then not even before I'm going to bed. Cause it's crazy, you know, you start scrolling and you see all this craziness and I'm like, so I don't do that. I
avoid doom scrolling. Yeah. For legit.
Yeah, that's what you should call this. Avoid doom scrolling.
Avoid doom scrolling. People will be like, what's that?
Yeah. Listen to find out.
Exactly. Now we're talking.
Yes. I read a lot. I probably talk my husband's ear off a lot. Poor guy. God bless him.
He chose it. It's fine. He's lucky.
Yeah. Yeah, I like taking my dog for a walk and just having like me time. I'm very big on me time. I think it's super important to just be alone and like be with myself. And if I'm really, really feeling anxious, I'll like take a walk or just like think about why I'm anxious. You know, I'm finding I'm sleeping a lot better doing these things.
Love it. Yeah, it makes a difference. So it's interesting that you brought that up. And then I have a question. Most people who struggle to fall asleep because their brain, I don't know if this was you, but like your brain, once your head hits the pillow, is like, let me think about all these millions of things.
Oh, yeah.
Yeah.
You're doom scrolling in your head.
You're doom scrolling in your head. Exactly. I find that happens primarily to people who make no time during the day for silence. Does that make sense? They don't sit with themselves throughout the day. So because your brain like filters all of these things on like a back file, right? And then when it's quiet, when there's not a lot of stimulation or focus, then it brings it up and it works through these things. But for a lot of people, the only time they have quiet or stillness in their day is right before they go to sleep. So then the brain is like, time to filter. And you're like, like, no. So people need more stillness. Walk your dog, right? We love Abby. We love her.
She's so sweet. Yeah, she's being crazy out here.
We love her. So we hang out with the dog. We, you know, process it by talking with friends or a spouse or a partner. We just think about like, man, why am I so stressed right now? What?
Talk to the dog.
Talk to the dog.
Not gonna argue.
Right. Yeah, 100%. Was that, it was a really good question, Rick. Was that a journey for you? Like, have you always taken me time, or is that something you've had to develop as like over time?
I'm sure it wasn't always a thing, but definitely for as long as I can remember. Probably, yeah. I mean, me time has definitely evolved. It's never the same thing. Like, I'm very much like, I try to be like, what do I feel like I need right now? What is my body telling me it needs? You know, like, do I need ice cream or do I just need some vegetables?
Keep talking.
It's definitely evolved. Like I just remember when I first lived alone, I hated living alone, but I definitely grew so much.
That was where I was going. How do you learn to be alone and be content?
Man, I feel like I helped my best friend through this because she hated being alone. She like was always with some dude that was bad for her, or she was on the phone for hours, or just like she couldn't do it. And for me, I was like, I don't understand. You know, like I don't get it. Yeah. So I remember with her, I'd be like, why don't you try to just like sit in your room and like organize something for like set a timer for like 20, 30 minutes.
Beautiful.
Just try that. Yeah. Start small. You don't have to be like, I'm going to spend this whole day alone. You can't do that. You know?
Yeah, no, that's probably too much.
Yeah. So I just remember doing that. And then I remember as our like friendship evolved, like at one point I'd be like, oh, are you going to come over? She'd be like, no, actually, I think I'm just going to like go home. And I was like, okay.
Excuse me.
Yeah. Okay.
Yes.
Yeah. So, I mean, like for me, I've just kind of always been that way.
Mm-hmm.
But I know for other people, it is a journey, but like start small.
Mm-hmm.
And just, even if you can't be alone, maybe listen to a podcast, listen to music, like
Solid.
read. Yeah. Do
something that gets your attention while you are physically alone.
Yeah, absolutely. Yeah. I mean, because I can't sit in silence for very long. I'm more of like a background music kind of person, so, but that's what works for me. That is silence to me. Like dead silence to me is so loud. It is deafening. I can't stand it.
Yeah.
But when I have like at least music on or like the TV on in the background, like, and I'll be doing something else, but I'm like, it just feels so good. Like I'm alone today and I'm like, I'm so happy.
Yeah. I worked on that with my boyfriend because I love, anyone who knows me knows like I'm so happy to spend time alone. I'm just like, I'm actually a hermit. It's fine. And I'd be like, please go. He'd be like, do you mind if I hang out with my friends? And I'm like, no, that's my dream. Like, please leave. Please leave me alone. And he was like, all right, so we'll just go off with his little work husband. And I'm just like, yes, I get to sit with my dog. This is great.
Yeah. Having an animal does help too, I think.
Dude. Yeah, because they're like, my cat does it. And I don't know if you have a cat, but Abby probably does it too. I call it bro time, where they're just like existing in the same space, but they're not like in your stuff.
Yeah.
Yeah.
She's definitely notorious for that. She has her spot on the sofa. And first of all, if anybody sits in her spot, she gets mad.
Well, because it's her spot.
Yeah. Right. Her dedicated spot. And then like also on the other end of the sofa. And it's like,
bro time.
I love you. Thank you for not being on me, but next to me.
I love it. So being a nurse in a pandemic is weird. We worked on self-care. What have you seen other like nurse friends do? How are they dealing with it?
That's a good question. My other nurse friends, a lot of us drink. Not that I'm condoning it, but we all love to drink.
Do you think that's like an epidemic in the healthcare field?
The drinking?
Yeah.
It can be. I mean, we see a lot of shit.
Yeah.
A lot of shit.
I actually think something I'm going to talk to someone about eventually is I think it's an epidemic with moms.
Oh.
Like moms who are kind of low-key alcoholics. Like, you know, all the marketing that's like, mommy wine time or mommy's adult juice. Yeah. And it's like a wine bottle. Like, I think it's effed up. But I know a lot of healthcare workers, and there's one I'm thinking of in particular who like has one of the worst drinking problems I've ever seen. Yeah. Like ever in my life. It's bad. So I'm wondering if you like notice a trend with nurses where it's like.
Yeah, I mean, I'll say more of us drink than don't drink. Like, absolutely. But I think like not so. Again, for me, like I'm not married to medicine, like saying that Andrew, my husband, works in finance. Mm-hmm. So truly, we don't even talk about like my day, which to me is fine because I know how to like handle it.
Yeah.
But I know for other people, that's probably really hard. Like to say that you had somebody that just died from COVID and you were literally the last person that they saw because their family couldn't come in. Okay. Like, and then you go home to your husband husband or wife is a teacher.
Right.
They can listen to you and they can sympathize, but that empathy isn't there. And sometimes you need that. And sometimes the best way to do that is to just kind of like have that glass of wine and just relax and kind of talk to yourself like it's okay.
Yeah. Yeah, I think it's hard when you're in a profession. Therapy is like that too, where the heaviness, like people don't get it. No one in my life who's not a therapist or a healthcare worker, and even healthcare has different levels.
Yeah.
Get it. Like I can't tell them like things that I hear or deal with because they're just gonna be like, oh wow, that's crazy. And I'm like, this is what most people carry all the time. They just don't tell you about it. Mm-hmm. And it's like wild with the gravity of what we carry.
Yeah.
That like normal people will never understand.
Yeah. I mean, I literally like, I remember being in school and I tried to tell I was doing my labor and delivery rotation. And like for me, I was so excited. I saw a live birth, like a healthy baby. Like I was in the room, like with this woman who was doing emergency C-section. And I just remember she like, they got the baby and the baby starts just, wailing as they do. And this woman has started, I mean, bawling and I don't have kids, so I don't get it, but I started crying too. It was like the coolest, most beautiful thing I'd ever seen. And I called my husband to tell him, and he was like, this is disgusting. And I was like, we're not talking about work anymore.
We're no longer talking about babies.
No longer talking about that anymore. So I am lucky in that I can call my mom and tell her that kind of stuff. So that is also a release. But I mean, a lot of the stuff you can't, not everybody's going to get.
Right.
You need your medical buddies.
You need your medical buddies. You need your, I hate the word tribe. I almost said tribe. I hate that word. You need your own community that get it.
Yeah. And you need, they're so important. Like there's some days where I'm like, I do not want to go to work. Like I already know it's going to be terrible, but I go because of the people I work with, because they are so great and we can dark humor our way through the day.
You have to. Yeah. So that's something I want to bring up, because I remember years ago, this is a random thing to remember, but when Hillary Clinton was running for president, they were doing a smear campaign where they were like, she laughed about abortion once. And I was like, listen, anyone in life who deals with effed up shit laughs about it. Trust. If I can't find the humor in someone being like, I'm literally going to go home and hang myself, I can't do my job. I just can't.
No, you would drown.
You would honestly drown. You can't sit in the gravity forever. You have to be able to be like, yeah, that's really effed up.
Yeah. I mean, and we all realize that these things are terrible. We're not laughing at them. It's almost like our own therapy so that we can get through it.
I feel like, wow, that's crazy.
Yeah. I mean, especially for you, hearing all of people's burdens and crises and, all those things.
Really
you would drown.
Yeah.
You would be so depressed and just weighed down. I just feel like it would be so heavy on you if you couldn't,
And it would be people who don't have, this is something we can jump into. So what about boundaries? How have you, because I can imagine being the last person someone sees when they have no family is a very different burden than when the family's with them and you can call them in. And so how do you not take that home and set a boundary with that? What does that look like?
Oh my gosh. Sometimes it looks like me crying on the way home. I don't know. I come home and I grab a glass of wine sometimes and I'll tell Andrew, I'll be like, I cannot believe what I just witnessed. I specifically remember we had this patient come in and he was in his 90s and it makes me want to cry just thinking about it. But he was so sweet and he was the coolest man and he was having an emergency. We got him through it. And prior to him going to sleep, he was like, I have to make it home. My wife is sick. My best friend, who's my 13-year-old cat, is sick, and I have to take care of him. Right. Thank you. And I know. And he was literally just like, I have to make it home because he's my best friend in the whole world. And I was just like, I honestly had to step away because I was going to start crying.
I'm going to die right now.
He wasn't crying, but I was like, I can't cry in front of him. Shoot. Don't be that person. Yeah. But I was just so heartbroken that he was having a medical emergency and he was more concerned about his sick cat and his wife at home. Yeah. So I remember on the way home, I definitely played my favorite music, cried a little bit and was like, oh, I really hoped that he made it home. Cause I don't know.
Did he go home? Oh,
I don't know.
Damn it.
That's the problem with healthcare too, is a lot of times I don't hear the end of people's stories. I don't know.
How do you deal with that?
Well, this guy, obviously, I'm still harboring it.
Some people you wonder about forever, though. You just do.
Oh, yeah. You do. When I was a floor nurse, I definitely created these bonds because you worked with these same people for a few days.
Yeah.
And I mean, they're sick and they need you and you are the person that they're looking to for answers because every other part of the healthcare team is in and out and you as the nurse are their only consistent face.
Mm-hmm.
And so they really confide in you and you really do create this special bond. And some of those times it would just kill me because they would leave and I would never know. Sometimes I did find out, like sometimes they would, come back to the hospital and you'd hear about their stories or whatnot, or you'd fortunately see an obituary, or so sometimes you do know, but a lot of the times you don't. And right now, being where I am, because it's procedural and it's in and out. It's in and out.
Yeah.
I don't know
a
lot of stories. And luckily,
That's crazy.
I know when I go to work, I'm going to see news stories to maybe replace those stories where I still wonder. I mean, there's so many that I'm like, that person was so nice. Like, I wonder what happened. Like, just talking about this, I'm like thinking of people that I'm like, I wonder what happened. I wish I knew. Like, some people are so nice that you want to take them home with you and care for them forever. Yeah. Others, you're like, bye.
I don't want to deal with you ever again.
I don't ever want to see you.
Luckily, with my own business, I don't have that problem. I want to deal with all of my clients.
Yeah.
That's why I take them on. But sometimes if I get a consult on the phone, I'm like, oh, no, I'm not for you. Like, I can't.
This isn't going to work.
Yeah, I am not the person for you. Like, I'm for a very specific type of person. And there's like, oh, no, like, I can't do it for some people.
Yeah.
Do you think you'll stay in the hospital? Like, what's the... what drew you to hospital work and to nursing in general? Why nursing?
Truly, this is going to sound silly because I feel like some people are like born and they're like, I'm going to be a doctor. I'm going to be a nurse. I went through like the whole gamut of like, I want to be an opera singer and I want to be a teacher. And
you sing?
Hell no, I can't sing. But
I was like, I've never heard you sing in my life.
There's a reason. But you can dream,
you can dream.
There's so many things I wanted to do. And then I specifically remember being in the car with my mom and I was like just about to graduate high school. And I was like, I don't know what I'm going to do. And when you're in high school, you're about to go to college, you're like, you kind of have to start figuring that out. Mm-hmm. And my mom was like, well, you could be a nurse because no one in my family is medical. Like no one. So yeah. And so mom was like, I think you should be a nurse. And I was like, yeah, I could probably do that. Like, I really am into science and I think I'm a people person. So I was like, yeah, I'll do it. And then, it just kind of spiraled from there. And if you had asked me, like sitting in that car, if I had wanted to be a nurse practitioner, I probably would have laughed. Even like 2 years ago, I probably would have laughed.
That's what you're doing now, right? So you have your BSN and you're working towards your nurse practitioner.
Yes. Yeah.
What's the difference?
So I will literally be your provider. So when you go to see your doctor, you can see me and we'll do the same thing. I have to work underneath a doctor. So I have to get, it's pretty much where like a doctor, there's, at least in the state of Florida, there's like narcotics and certain drugs that I can't prescribe. So then obviously the provider I'm working under would do that for me. And they do a lot of like chart audits just to make sure that you're like, hitting your points. But I would be if you have a cold, I will give you something.
That's pretty cool. So you can basically do almost anything that a doctor can do.
Yeah, pretty much.
Can you have your own practice? But you would have to work under...
Yeah, you can have a satellite physician. My brother's mom actually does that. She has her own clinic here, and she just has a physician that like does her auditing and she can rely on for certain things, but you can.
Is that what you want to do or what do you want to do?
Girl, I don't know. When I was in nursing school, I thought I was going to work in the ICU. And then I graduated and I did not go that way. And I'm actually really happy I didn't. So I don't want to like limit myself to anything. I definitely am going to do some of my clinical hours in rotation with her just to kind of, get a feeler for it. I want to do some hours with cardiology and like, I think I'll probably do some hours with GI as well. But you never know, like that's the beautiful thing about healthcare is you can pretty much do whatever you want. Like,
true.
Like, honestly, there's so many. You can be a school nurse. You can sit at a desk and have a desk job. You can go out in the field and be a medic. Like, there's just so many things you can do. And that's what I really, really do love about it is I'm never just settling on one thing.
Yeah. So I talked to like my mom, for example, worked one job for 30 years and that makes me want to die.
I can do it
like
either.
I literally would want to die. So like for someone who says, I don't really know what I want, but I want to be in this field, like nursing would be a great opportunity because you can switch jobs.
Yeah. There's just so many possibilities. Oh, and you can go travel. You can have someone else pay for you to travel.
Yes.
Like, that's honestly why I got into it too. I thought I was going to go travel and like go see the world, and never did that. And that's okay. But
you can do it later.
Yeah, it's still on the table.
There's still time.
Yeah.
So what would you say?
Go ahead. Well, even as a nurse practitioner, you can still practice as a nurse. You don't have to get rid of your nursing license. So that's another.
So you could do it like part-time.
Mm-hmm. Yeah.
What would you say to someone who's considering nursing?
I'd probably joke and say run, but don't run. I say do it, man. If you're going to do it though, like commit and do it. Don't like say you're going to do it. And then like, I have a friend who literally went through all of nursing school, passed, he went and took his test and failed it. And now it's been like a year and he's not a nurse. He's not even like in the healthcare field. He's doing something else. Right. But I'm like, you literally just worked so hard.
Right.
One failure is not, I failed the NCLEX the first time I took it.
Right.
Oh my God. And I cried for like 2 days, like legitimate tears rolling down my face. Cause at that point, that's all I wanted in life was to be a nurse and like have my own career. But I went back and I took it, and I took it in under an hour and like the least amount of questions. You just do it and make sure you're doing it for the right reasons. Like, yes, there's a lot of money in it, but make sure you're doing it for these people that need you.
Because you're going to also work with people that you don't like.
Oh no.
And aren't nice to you. And like, if you're only in it, right. If you're only in it for the money, you're going to hate that part of it.
Yes. Hate it. Oh yeah. You definitely, I always say like, before you do anything, you can almost like shadow almost any field. Like,
oh yeah, literally any field. Just email someone, call them.
Just go see if you can like even volunteer at the hospital for a little bit. I did that when I was in high school.
That's a good idea.
Yeah, just make sure it's what you want.
Yeah. I think a lot of people, so I have a lot of young people who say they get paralyzed by, I don't know what to do. I don't know what I want to do. And so I have to figure that out first before I can do anything. And that's really problematic for me because I'm like, why? Like, I understand not going and, specifying a major and spending all of this money, like that's a separate conversation. But if they're just like, well, I have to know what I want to do before I go to college. And it's like, you probably have a year to figure that out anyway. And take that year to figure it out. Like if you try something and if it sucks, do something else.
Move on. Yeah. I mean, for anything, there's so many prerequisites. So you do have all that time.
For nursing, yeah, for sure. But most colleges, you have to spend a year and a half doing your prereqs exactly before you can really get into a major.
Yeah. I mean, you just have to be willing to put in the work. Like even if you go to college and you don't know, put in the work, shadowing other people. Like, honestly, at this day and age, you can probably just go on YouTube and like, do an inside view of certain things.
So true.
Like watch a few blogs or vlogs, just kind of.
Blogs.
Blogs. Yeah.
Blogs. We love them.
Yeah.
Ooh. Yeah. I like the turn that we have taken because I think a lot of people struggle with like not knowing what they want to do. And I was never that person. So I'm just like, this is not that hard. Just pivot if you hate it. But like sometimes that's not what they want to hear. But I'm like, that's
no. I still have friends that don't know what they want, and we're all late into our 20s, and they like
do something.
Yeah.
Do something.
Just try it.
Right. Try it. If you hate it, do something else. But I think a lot of rhetoric too in the US is like, you are your job. Like when we first meet someone, what's one of the first questions we ask? What do you do?
Yeah.
Right. And that tells us I'm going to put that in quotes, tells us so much about a person, but we really make jobs an identity. And I think a lot of other countries are just like, it's just my job. Like I'm more than the work that I do.
Yeah. I think I like that you say that because like, so back to like the nursing and like the pandemic when, you just hear it from other people. A lot of people are like, well, you signed up for this. You knew what you were getting into. And I would get so frustrated with those people because I'm like, no.
You did not sign up for a pandemic.
Yeah, thank you. I did not sign up for like these crazy working conditions. And
right. No.
I'm so happy you said that, because that just drives me crazy. I'm like,
Yeah,
yes, I
super...
knew that I was getting into nursing, and like, it's crazy. Like one day I could be watching someone born and then hold a dying person's hand. Like it literally is both sides.
That's expected.
Right.
But like,
it is not expected for me to be the last person that this dying man sees.
Right.
It is like,
right.
Because we can't bring their family in.
Right.
Like I just hated that. And I was like,
yeah, that's super, that's so shitty. Don't say that to your nursing friends, people. Like, no, you did not sign up for that.
Don't do it.
We will bunch you. I will hunt you down and bunch you in the face.
Yeah. Oh, it gets so frustrating.
And I'll be like, you signed up for it.
Yeah. Like,
gross.
No. And like, and in the beginning when we didn't know anything, it was scary, because you would go and people were scared because they were bringing this back home to their families. And then you had outside people saying, well, you signed up for this. You knew what you were doing when you started a family. And it's like,
oh my God,
my job is not my family. My family is my family.
Right.
And as a person, it's my job to protect my family.
Right.
Yes, I love what I do. And I mean, for me, like, I am a nurse. It is who I am. But like, me first. I can't.
Right. 100%. Like, oh, you signed up to bring a deadly virus home to your family. Sure didn't.
Like, that wasn't on the application.
I was not on the application of the hospital. So I literally did not.
Yeah.
Sign up for it.
So frustrating.
It's crazy.
Yeah.
That's just, if you're someone, like, if someone's listening and you're someone who said that to someone, like, please jump off a cliff.
Apologize.
Apologize and then jump off a cliff, or I will hunt you down,
right.
punch you in the face.
Yeah. I tell people that at my job all the time. Like, this is not the end all be all. And I hate that, especially at the hospital. It's like, and I don't know other, businesses, but like at the hospital, it's like expected that this is your life and you commit to people. Like, I literally have to click a box when I'm discharging somebody that says, I have asked this patient if they've had a wonderful time, and if there's anything I can do to make their care exemplary or whatever.
Exemplary.
Yeah, that one. And I'm like, I have to click this box. I'm not a Marriott staff.
Right.
Like,
I get customer service, but come on.
Yeah, I can't discharge you until I click that box. And I'm like,
that's wild.
Yeah, I have no problem making your stay at the hospital, because it sucks being at the hospital. Like, nobody wants to be there. I get it. I will make it as easy as possible, but I'm not pouring my whole being into making it exceptional for you.
Right.
Are you leaving here better than you came in?
We hope. We hope so. Yeah, I take that stance with clients a lot. So something I say to clients that I always wonder, because sometimes I don't, well, they've never told me, but sometimes I wonder if it lands really wrong. So, and I'll just say, I don't care what you do outside of here. I literally don't care. If I'm helping you and I'm here's options, you choose what feels best for you. I do a lot of do what feels best for you, and how do we figure that out? And you're really the author of your own life and the captain of the ship and all these things. But I'm if you don't want it, probably in every session, I'm if you don't want to do it, don't. I don't care what you do, because my life is fine. I do what I teach 90% of the time. So it's good. But I was if you don't want to do these things and you're miserable because of it, that's literally not my problem. I don't care what you do outside of here. I hope that you live your best life and change and do these things, do the hard work so that you're happy. But I'm I don't actually care.
I don't think you can care. Could you imagine? That's that's a lot.
Yeah.
Yeah.
I'm not responsible for, I'm not even responsible for what people do at my farm. I'm just if you want to do the work, great. And if you don't, jump in the fire that I have going. I don't know what to tell you. I can't do anything for you. I can just support you. But I tell them all the time, I'm I don't care. I mean, I do care. I want them to be happy.
Yeah. It's that humor where I feel it comes off worse.
Yeah, and I really wonder if people are wow, you're the worst counselor I've ever heard of in my life. How dare you? But it's a very fine line. And I'm sure you've experienced this, I care about your well-being and I want nothing more than for you to be happy and healthy and thriving. But there's nothing I can do about it. Nothing.
Yeah. You have to put in the work.
Right. And so I don't care. Put in the work or don't. I'll help you regardless for a certain amount of time. If you're doing nothing, I'm you're fired. Like I can't.
Yeah. Well,
I
if
can't
you're gonna be better, like what's the point?
Right. I'm not just going to take your money. But it's the same with like people at the hospital. Like you still have to do what the nurse is prescribing, and you know,
and they tell you to take the whole bottle of antibiotics. Take the whole bottle.
Take the whole bottle. It
Huge
doesn't.
pet peeve.
Well, why do people do that? Can you explain why that's important?
That they need to take the whole bottle, or that they don't. Okay.
Maybe people don't know.
Okay, so this is a good learning point. So antibiotics work as like a series. Like you need every single pill that they give you to eradicate what's going on in your, whatever bacteria you've got going on in your gut. So a lot of people will take like the first 5 of amoxicillin and they're like, I feel so much better. This is great. I'm going to save these other 5 for the next time I feel sick. But what you're doing is you're creating these super bugs that we have to create more antibiotics for. And that's not easy. Like these drugs have to go through rigorous trial and error to even make it to like the pharmacy.
Yeah.
Like I think I just read something and it was like, I can't remember, don't quote me, but it was either 4% or 14% of drugs that actually make it to the counter, which is ridiculous. Yeah. So don't save that extra 5 pills just because you feel better. Like if you take the extra 5 pills, you're going to completely knock out whatever bug it was that was in your system. And chances are you're not going to get the same one. Or if you do, your body might know how to fend it off better. And I know you kind of run into like the ethical issues of like, well, people want to save them because they can't pay their copays or they can't afford this antibiotic again, which is understandable. And then you run into, but just finish the bottle, please.
Finish the bottle, and then hopefully it won't come back because you will have completed the whole protocol.
Yes. Right. Yeah.
And for people that struggle to afford copays, there are many, many pharmacies who do programs where they will help you. So literally ask your pharmacist.
Yes. Yes. Ask the pharmacist, ask your provider. Like if they don't have something that can help you, they have coupons. There's a lot of dispensaries that actually dispense for like a fraction of the cost, if not free. Like I know there's certain antibiotics you can get for free at Publix. And then there's certain blood pressure medications you can get free at Walmart. Like have an open conversation in case that is your issue.
Tell your provider you can't afford it.
Right. Yeah. There's no shame in it. It is what it is. Medicine's expensive. It's crazy, the inflation that we have. Like,
I'm glad you specifically said inflation.
Yes.
Because that's exactly what it is.
Yeah.
Right.
It's not, when you can look at a chart of like insulin, what it is here in the States versus what it is like in Europe. And it's crazy.
And it's exactly the same thing. It's just marked up 1,000% because
it's just all greed.
The US are greedy monsters and we hate them.
Yeah.
We dislike.
Rough.
Yeah.
Yeah, but take all your antibiotics.
We're probably, the reason I don't like Zoom is when I use Skype, it tells me how long the interview is. On Zoom, it doesn't, but we're probably nearing an hour.
Oh my gosh, really?
I know. You've done so well.
Thanks.
You're killing it. What else do you want to hit on? Nursing, self-care, existing in a pandemic?
So this is actually, I had to correct my father-in-law on this yesterday because another thing that drives me crazy is when people mix medicine and politics. I hate that. That's why we have an inflation problem.
True.
The pandemic's not fake. It's very real. You can think that it's fake and that's fine, but it's not going to hurt you to wear a mask or just not go out. Like, I wish politics would be taken out of medicine. So, like every being in my fiber, like I hate when, I can't even remember what he said last night, but I was like, no, sir. Like,
actually, no.
Yeah. It was something about like, somebody's going to change something or like healthcare is going to be free or something about Dr. Fauci, maybe even. I don't know. I just remember I was like, Dr. Fauci is a saint.
How dare you, sir?
I love him. But yeah, I wish that the two people would not put the two together, which I'm sure people feel a lot with politics. Like it should just be politics, not politics and not politics.
I mean, but politics affects life. Like everything is political.
It does, which is sad. It's just like, at least with the pandemic, like, I wish that we could have handled it so differently. And I feel like we'd be in a different place right now.
Yes.
You know,
I think it's a very American thing to cry about your rights being taken away for wearing a mask, but then they absolutely want to take away a woman's ability to have birth control or abortions or healthcare in life.
And all we're saying is wear a mask.
Right. Or like, it's totally fine to sterilize women at the border, but wearing a mask is a violation of your rights. Like, please go off all the way with that. Like, just all the way off. Have all the seats, actually. Like, no.
Yeah, it's so frustrating. It's like, I don't know. There's so many ways we could have.
Yeah.
Obviously, maybe not like eradicated it at this point, but just like handled it.
It could be less. Yeah. Although I think it's really interesting, the difference between a state that's pretty open versus like a state like North Carolina. I'm sure there's other factors, obviously. Yeah. Everything is intersectional, but it's interesting, like the death rates you're seeing and the hospital flow that you're seeing. Because, for example, our local hospital, they're flying people out of state because all of our hospitals are so full. Like, elective surgeries are not happening. They're shutting down the ER at like 10 a.m.
Wow.
It's crazy. Yeah. It's so full versus a hospital like you work in that serves exponentially more people than our hospital. And it's like just now full, like almost a year in, but we've been that way for months.
Yeah. Yeah. Almost. Crazy. I mean, the only thing I can think of is like the acuity of the hospitals there, like how sick
Amazon. Okay. Like, what is happening? What? Like, they're little like drones?
No, we literally are on the flight path for Amazon into Lakeland Linder.
I forgot Amazon built a plant out there.
Sorry, I'm outside. It's just so nice down here.
Yeah, right now outside, I think it's like 50.
Yeah,
which is not bad.
It's like beautiful here. What were we talking about? I got the plane.
Crap. Here's the thing, my brain is a bag of cats 90% of the time. So we were talking about
the acuity of the hospital. You don't know what level of acuity like your hospitals are serving. Not to say that like ours.
What does acuity mean?
Like how sick your patients are.
Thank you.
I think it's on a tier system. It's like 1, 2, 3, 4, maybe.
Yeah. Something.
They go on different levels. Because I know you're in like a more rural area.
We're also the only hospital, I think, in the county.
Yeah. So it's very like, that's crazy that they're flying people out, which like, but it makes sense though. Like it is it's getting a little crazy. Like I'm honestly just kind of waiting for the next shutdown. I'm like, I feel like it might happen.
Yeah.
I'm not sure.
I'm interested to see what the new administration is going to do with restrictions.
Yeah. I know, like for me, I'd be fine if we did a shutdown again, but I'm also a nurse and I have a job, so I get it. Like I understand.
Right.
But I'm also a nurse and I'm like, please quit getting sick.
Please stop going places.
Yeah.
Like I want to travel too, guys.
Yeah. I couldn't take a honeymoon because of it, you know? Like, it sucks.
It does. Yeah. So what do you want to leave our people with? They've listened this far and they're like, oh my God, Aliana is so cool. We love her.
Probably she has a lot to say.
It's a good thing.
Yeah.
We'll do multiple interviews. I just should do interviews where I just like bullshit with people and just call it like the bullshit podcast.
People would probably love that. I love listening to podcasts that are just like two people talking about like who knows what.
So fun. We should do that. Like just some kind of like separate series where we just talk about cool things. Anyway, what do you want to leave our people with? If you were like one thing.
One thing
what is
probably through all of this, take care of yourself first. Because if you can't take care of yourself, then you can't take care of anybody else. It's the oxygen mask on the plane. Like put yours on first before you help others.
Preach, girl.
Yeah, I live by that. Like if I'm at work and I'm so hungry, I feel like I'm going to pass out. I'm like, I'm going to have peanut butter. I can't,
almond butter though. Life.
Well, peanut butter is, I always joke like peanut butter and graham crackers are a nurse's favorite snack because that's all they put in like the jars that are free.
That's funny. That's funny because David was just talking about that last night and I've never even heard of it.
Oh my God, that's like the only thing you can get at the hospital. Like that's what we keep in our nourishment rooms. So I just always joke that like, you know, if you're too busy and like you can't take an actual lunch break, you just like spoon the peanut butter down your gullet.
Peanut butter and graham crackers. That's funny.
Yeah.
All right, dude. Thank you so much. Yeah. For everyone listening, if you have questions or you agree or disagree with anything we've said, like, talk to me. Yeah. If you're a conspiracy theorist, don't talk to me. I'm not going to talk to you. I'm literally going to block you and shut your shit down. Like, I'm not doing it. But if you have other valid opinions, come at me.
Yay. Yeah.
Yay.
I love it.
Y'all, I told you she was dope. So you're welcome for that. Again, if you need any support, get at me via Instagram at Amanda_chills or through the website livemyhappyhealth.com. Or just a reminder, we've got 3 steps to build healthy, sustainable habits. All right, y'all, go enjoy your day and like kick some ass. Love you. Bye.